The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's call. Give us just a moment as we get the screen ready to go. Okay, and then if you just want to do the display settings like we had talked about, because you're in, yep, and then swap. Perfect. All right, everyone, thank you so much for joining us today. At this time, I would like to introduce Greg Core, the Division Director of Monitoring and State Improvement Planning with the Office of Special Education Programs. Greg?
Thank you, Jennifer, and I want to wish everybody a happy almost Valentine's Day. This is OSEP's February TA call. I'm here with one of my colleagues, Christy Kavalik from the Research to Practice Division. Our topic today, I'm assuming you all know since you've registered and joined the call, we're going to hear from the Early Childhood Personnel Center, and our speaker is Mary Beth Bruder. Have one short announcement before we roll into that. As a follow-up to last month's call on the new Part B grant application package, we'll be providing additional information about the new Section 5B, and that's the section, if you're a Part B person, you may have seen this already, for the significant disproportionality information that all states are required to submit. And because it's new and it's a little more involved than what we've been used to, we are devoting an entire call to that topic and how you fill out the data form that you'll have to be submitting with your application. The call will be at 4 o'clock on the 20th, which is a Thursday. We will be sending out call-in information tomorrow, but I wanted you to be aware of this and get it on your calendar. So again, that's a call on the significant disproportionality data submission form in the Part B grant application. It will be Thursday, February 20th at 4 o'clock. Now I'm going to turn over the call to Christy.
Hi, thank you, Greg. I also had an announcement to make prior to Mary Beth presenting for us. Today, we published a notice inviting applications. This is for a leadership development program to increase the capacity of leaders to improve systems serving children with disabilities. So this is a grant competition that we published last year. We are republishing it again this year to accept new applications. The eligible applicants are Part C lead agencies and Part B SEAs. The intent of this program is to support Part C and Part B at the state level to build a leadership development program to recruit, increase the capacity of, and retain a network of leaders, either at the state, local, regional level, to improve systems serving children with disabilities and their families. So we're very excited about this grant opportunity. It will be closing on April 13th, and we will be posting on the chat box the link to the Federal Register, where you can find information about this grant competition. But we hope you take the time to look at it and consider applying for it. So with that, that was the announcement I wanted to make on the competition. So I'm going to be turning it over to Mary Beth Bruder. Mary Beth began her career as an early childhood special educator 44 years ago. Since then, she has been involved in the design, provision, and evaluation of inclusive early childhood intervention services for infants and young children and their families within local, state, national, and international venues. She has directed over 85 demonstration, outreach, research, training, and technical assistance projects as well as personnel programs. Currently, she is a professor in the Schools of Medicine and Education at the University of Connecticut, where she directs the University of Connecticut Center for Excellence in Developmental Disabilities Education Research and Service. And she's also the project director of the Early Childhood Personnel Technical Assistance Center, funded by OSEP. OSEP has funded the Early Childhood Personnel Center. I think now we're going on year 7, and this is a center we are very excited about, in that the intent of the center has a number of outcomes, but one of the outcomes is to specifically work with states, the Part C agencies in the Section 619 programs, to really support their capacity in building comprehensive systems of personnel development. We know that a lot of states really want to look at the personnel in their system and think about how they can increase both the competence and competence of their providers, as well as to make sure that we have the right number of providers in the system. So the ECPC Center has really tried to think about what's involved in a CSPD and what the competencies are that providers need to know to be able to most effectively work with young children and their families. So Mary Beth today is going to share one of the activities that her center has worked on as a way to support providers in gaining competencies so that they can most work effectively in early intervention. So Mary Beth, we thank you for your time on today's call, and we look forward to your presentation.
Thank you, Christy and Greg and Jennifer. It's a pleasure to be doing this for OSEP, which has been a great supporter of our work over the many, many years. And most of us wouldn't be doing the work we're doing if it hadn't been for all the dedication of OSEP and the work they continue to do. Even though sometimes we get discouraged, they keep us going. I am going to be spending today doing 2 things primarily, and I'm doing this on behalf of the team that I am lucky enough to work with on the Early Childhood Personnel Center. This is certainly not my work. This is the work that represents not only my leadership team, but also members of work groups and stakeholders from around the country who have helped us really articulate what the kinds of things that are needed out in states to improve the workforce. So I'm first going to give you an overview of ECPC and some of the ways we have conceptualized technical assistance, and in particular, how we're looking at workforce competencies and personnel standards. And then, of course, where is the role of practice? And then I'm going to give you, as the example, a description of the development of one area of competencies that we've been lucky enough to partner with our colleagues from the related service disciplines. All the organizations have been working with us for these 7 years to really see if we can get a unified vision for the children who we serve and their families. So I'm going to start really basically by reminding everybody that our goal is always improved outcomes for infants, young children, and their families. And in order to do that, we have to have services that are effective, which means that we have to have a workforce that has knowledge and skills in evidence-based practice, as well as the values that we hold very close to our heart in order to ensure that services are effective. We have identified the fact that many states have really different pockets of ways to enhance the workforce, but we had been lacking in a comprehensive system. As Christy had mentioned, comprehensive systems of personnel development is really the focus that we have. Now, this is something that started, for those of you really, really old like me, way back in the 70s in the very first Education for All Handicapped Children Act. It really wasn't the first act, but it was the first time it was mentioned in 75, which, because we had such shortages, they required, the law required all states to have a comprehensive system of personnel development. So all we have done is taken it and tried to modify it to fit specifically early childhood and infants, which is the Part C program, infants and toddlers and early childhood. In the 2004 amendments, CSPDs were no longer required. The law actually acquiesced to the No Child Left Behind professional development requirements. But we did have one piece that stayed with Part C, but it wasn't a real comprehensive view. It was targeting a few very needed areas. And as a result, through another OSEP-funded project that my colleague, who is also on ECPC, Vicki Staten and I were able to do a number of needs assessments and focus groups around the country to see that once something wasn't required, we weren't really seeing a comprehensive view. So what does that comprehensive view look like? Again, I am acquiescing to the law. This is not out of our brains. This is really the brains of those who wrote the original law, with the exception of leadership coordination and sustainability, which is an added component. But we feel that if we're going to look at the workforce across disciplines, those who serve young children, infants, young children, and their families, so this also goes through Big B, I would say, we have a number of components that have to work together. Otherwise, we don't have not just the comprehensiveness, but we don't have the sustainability. Starting with the most important, recruitment and retention, which is how do we identify, hire, and maintain the workforce across sectors and disciplines, to standards. What are those discipline-specific knowledge, skills, and competencies for the workforce? Pre-service training, which is those formal programs of study at any IHE, which starts with 2-year degrees all the way up to doctoral degrees. How do we enhance the capacity of IHEs to really focus in on those personnel standards, which are skills and knowledge that our workforce is going to need, not today, but the next 5 to 10 years. And then in-service training, which is how do we maintain the skill set of our workforce? Many times we neglect this, or we do it somewhat focused on whatever is the most burning question, burning area, burning domain, or PD provider who's coming in. What we've really seen is that we haven't acknowledged the fact that pre-service training is just the beginning of lifelong learning for many of our workforce. Therefore, our in-service needs to be supportive and needs to be personalized. As people take jobs, move out of jobs, move into jobs, they need to be able to build their competencies. And as I mentioned, that top one, which is very timely for that announcement today, leadership coordination and sustainability. In order to build and maintain a CSPD, we need leaders who know how to coordinate, but more importantly, sustain a systems change. Because we don't want to build things and then when either people move on or something changes, and funding is always a challenge, that a system dies. Evaluation has to be built in everywhere if we're looking for outcomes. So why do we need the CSPD? It really is a value, but it also has been proven based on the data that we collected in the personnel, the Center on Personnel Policy and Practice, that showed that once we didn't have CSPDs, we did not have a system by which we could even count what type of skills were within the personnel and what type of in-service training personnel wanted. And more importantly, we've been able to see down the line that we have always and continue, and now are starting to get even bigger shortages across certain areas, including special educators. We feel that the CSPD promotes effective practices and the implementation of legal requirements. And I think that's very important for everybody to understand that we're doing a job that's a passion for most of us, but it's really governed by IDEA and the values inherent in there. So our Early Childhood Personnel Center is funded to provide TA to build CSPDs now, and I just put this up here to remind us, why are we doing this system, as opposed to saying we're only going to work with higher education, or we're only going to work with C and 619 for preschool and early childhood, or B, it's because we feel that the system has to be a unified whole. We cannot just work with our state leaders without acknowledging the importance of those who set licensure and certification requirements and those who are in higher education. We need to really get an interdependent group if we're going to make a large enough impact. Now, this CSPD, we have been very fortunate to work with our colleagues at ECTA, Early Childhood Technical Assistance Center, in their systems framework. This piece is the framework of early childhood personnel, in particular development. And as you can see, our 5 areas are down the left, and we have indicators. And within each of those indicators, we also have elements of quality. We use this as our benchmark to help states, both state teams and then state leaders, look across their different components to see if they have these indicators in place, such as a leadership team, such as state personnel standards, which are aligned with national, such as programs and curricula in higher education are aligned with those standards. It sounds like that should be a no-brainer, but unfortunately, there's so many different competing priorities that isn't always the case. For example, curricula in higher education needs to be focused on the most evidence-based practices and specific pedagogy. Inservice, making sure that we are looking specifically at adult learning and how adults do learn, all the way down to recruitment and evaluation of the system. So this has provided us the framework we needed with the elements that are underneath to help states move forward. But more importantly, it has also reinforced in us the notion that having a CSPD is a necessary and integral quality indicator of any type of early childhood service system and the workforce. And here's why. Under Part C and 619, Part B, you can see the variety of different backgrounds people have when they come and provide a service under the title of their discipline. For example, we know some of these disciplines are very medically focused, meaning they actually are in usually allied health, and some are educationally focused. Some are very specialized, such as orientation and mobility specialists, and some are more broad-based. But nonetheless, all of them are focused on providing services under the law of IDEA and under the guidance of an IEP or an IFSP. Yet, very rarely have we seen these types of personnel in these disciplines getting trained together or even having the opportunity to look across these disciplines to come up with what are the commonalities that a family is going to benefit from, and more importantly, a child. So we go back to the CSPD and we look at where do the different disciplines fit? Well, the answer very easily is they fit under each one of them. And therefore, we have really done a comprehensive view of the different disciplines that are involved. And our TA has been focused on looking very specifically at knowledge, materials development, and delivery of services. And under the knowledge, we have used the CSPD framework to identify both the research that is out there to provide the evidence, as well as needs assessment and assessments of practitioners who represent the different disciplines. We turn those into very specific tools that people can use, and then we deliver the TA. So as an example, in regard to our data that informs how we develop our materials, this is data taken from all Part C and 619. Our colleagues, if any of you are on there, we thank you immensely because people filled out their comprehensive system of personnel development, self-assessment, and in fact, what they did was able to show us what they have in place and where they're going. The 3 means everything's in place across all of these sub-components. And as you can see, we have a ways to go. We're doing well, and we're doing best in state standards, which is interesting but not surprising, because standards do dictate what happens at higher ed. But we have some other areas that are really challenging for most states. So when we take something like this, we also have collected data across, and that data is represented in Data Report 1. But we have data across a variety of other areas, and what's bolded there is a data report on the cross-disciplinary, which we're going to get into as the second part of this. But we have all of these needs assessments. We also have done literature syntheses and reviews that tie into the different components. And what's bolded is, again, showing you the different components of the CSPD that we have the lit reviews available. So when we look at this, we have used that first left-hand box to develop a lot of knowledge and a lot of information that feeds into what our stakeholders want and need. And then we do drafts, and then they tell us whether it's good or not good. So as examples, using these components, we have tools in each one of them for states to use, such as under leadership, we have leadership brief and leadership checklist, which I'll show you in a second. Under pre-service, we have 7 briefs on important components of pre-service training as per the literature. In service, we have a checklist for adult learning and trying to change any system or adult's behavior. And TA, which really governs how we do our work, we have a checklist that came out of, again, literature. For example, under TA, these bolded large components came out of the literature synthesis, which said that the most effective TA has a technical assistance preparation, that there is a needs assessment for decision making. There's a plan with measurable goals and objectives, which I love, intervention practices that are going to be used and the resources, and then implementation. How do we help people learn? And then how do we provide specific feedback through coaching and mentoring, evaluation, and then how are we going to sustain any changes we do? Effective in service, this is not news to anybody in our field, but basically the data now is pretty strong that talks about student field experiences as being one of the strongest outcomes that we can provide our students who are at higher education programs. The different types of teaching methods that are effective, clinical supervision, coaching, mentoring students, course-based student learning methods, cooperative learning, and web-based and e-learning, primarily to support, not supplant. And as we know, this younger generation, prior to this call, we were all talking about our growing up children who are living by their phones. I mean, it's a very different learning than I had a gazillion years ago. We turn these into briefs that are, for this one as an example, higher ed faculty have edited and changed and made better so that they can use these. And that TA then gets turned into something that's more usable, such as a checklist, which I'll show you in a second. This is our effective in-service training, which we've turned into a checklist that states can use when they're going to be developing any kind of in-service. And in fact, since the data are so clear, to me, it's an ethical issue if we're not doing all of these things when we're trying to introduce new skills to our workforce. So back to here, where does the standards fit? Now, as you see here, we have standards that primarily say knowledge and skills. We actually have a map that we've developed that you can click on any state and find what the personnel standards by discipline are. But we dove a little deeper into that. And in fact, what we did, we have a number of different activities in this area. What's underlined is what we're going to talk about from here on out. But we have been very privileged to be able to support the development of the early childhood standards that Division for Early Childhood of CEC will be bringing forth to CAPE. And they will be the standards that govern all higher education programs that are CAPE. This is those in higher ed. No, it's Council for Preparation of Educators. But more importantly, these standards will guide the preparation, whether you're using those initials of CAPE or not, because they were brought together by a task force who have, again, done lots of listening session and have used the evidence that's available to develop standards. Now, the reason standards are so important is because they are enforceable. They're enforceable by higher education programs, meaning higher ed programs have to meet standards. We are proposing that they now meet these early childhood standards as opposed to the CEC standards, which are school age with a specialty set. These will stand on their own. Excuse me, I'll come back to the cross-disciplinary, but we've also been very fortunate to work with our CN 619 coordinators across the country, where we have a set of leadership competencies that are in a hierarchy, and they cross 3 different domains of behavior, and we are very excited. We spent the morning with our colleagues at ECTA laying out a year full of activities to provide opportunities to our CN 619 to now work on building competence in the areas that they identified and that they really refined multiple times. So it's something that we hope lives well beyond any TA centers, but really lives within the leadership area. And then we've done a variety of alignments and tools. So we have alignments for higher ed faculty, as an example, to be able to align their syllabi and programs of studies to the DEC standards, both the old and the new, the recommended practices, and then these cross-disciplinary competencies. We'll also be looking at leadership competencies and aligning them into some of the areas in which our states are going to tell us through this first year of putting them into practice. But the cross-disciplinary are primarily an effort to look across disciplines. What are the competencies that all of us need, no matter what our pre-service background and our license says? What is good practice that we share? So we have developed and I'm going to pass this right now. We had developed this methodology, and this took us almost 5 years. And the reason I tell you that is because anything that's really worth getting people's buy-in is going to take you that long. We know systems change literature tells us it takes 10 to 15 years to sustain a change, develop and sustain. So this has really been kind of a labor of love. This was not intensive work because we had a lot of volunteers who gave us up to 4 times a year, not even a day's worth of their work. They did work in between, but it wasn't a lot of time because the people who we had involved in this all had very busy lives like you all do. But we felt this was real important, and we kept going back to get validation. So what we did is we established a stakeholder group. We drafted core areas and sub areas. We reviewed, and I'm going to share those with you. We identified standards and documents across disciplines. We aligned and categorized them into competencies. We defined these competencies, and we have the final review. And I should say, what's not up here is we also had endorsement by all the professional organizations, which was a really big coup, not for us, but for the organizations, because the members of the organizations who were part of this workforce absolutely had a passion and took this right to them. So here's one of the things I have to start with, though, is we banter around a lot of words without defining what they are, whether it's a competency or a standard or an indicator or a practice. So we kind of stuck to this. We've got a lot of this data from the interprofessional competencies. There's a beautiful document they did which really delves down and uses this, and they've been doing this for over 10 years. We've also used the maternal and child health work on the LEND competencies. So the standards is really the highest mark, and our work in this area and in all of our areas is that our work, meaning ECPC, is not at the standards level except for supporting standards being developed. Standards is what you know and need to be able to do, knowledge and skills, but it is enforceable, as I said. So OTs, occupational therapists, have their own standards. PTs, speech and language pathologists, nursing, social work, everybody has professional standards by which we hope licensure is built around, but mostly pre-service is built around. The difference between a standard and a competency is an ability or skill to meet that standard. Can you do that? And you can use competency in a variety of ways. The issue about a practice, the practice is just doing something. It doesn't necessarily say that an individual can do it. But you can add an indicator to a practice, which is really a performance measure, if you will, but we use indicators for competencies. The practice is embedded within the competency that we pull together. So the work group was consisting of CEC, DEC, NAEYC, AOTA, APTA, ASHA, and 0 to 3. We actually started working with all of these groups well over 10 years ago in the very first Personnel Policy and Practice Research Institute that Vicki and I directed. And at that point in time, nobody was really willing to give up any of their own focus. But we kept meeting with them, and we developed relationships and trust, and it really was through ECPC. And one of our requirements in our RFP that said, you know, it's time, let's look at something that uses a common lens. So we started way back by coming up with just dialogue, nothing systematic. What did we feel all practitioners needed to do? And interestingly, these turned out to be the guiding marks for us: coordination and collaborate, family-centered practices, data-based intervention, and professionalism. And then we brainstormed. Now, this is a group of less than 20 people. Each organization sent an organization person and somebody from the field, usually somebody in their leadership, though some of the same people have worked with us for many, many years. And we brainstormed to see, could we come up with something that made sense, that everybody could adapt? These are the dates that shows you how long we've been working on this. We reviewed the preliminary areas, and since we didn't meet that often, this just shows you where we were. By April, everybody decided, because we had just finished an alignment for DEC, that maybe we should kind of kick this up a notch and really do it systematically. The difference and the challenge was that each organization had different guidance documents. So nobody had the same kind of guidance. So organizations provided between 1 and 10, as you can see, documents, and then secondary documents. So what did we do with those? Basically, these are all the source documents that we took that were given to us to use, is we basically did analysis, and we crossed across all those documents to come up with very specific alignments. We aligned them specifically to those 4 areas. We got reliability, and then we did a thematic analysis to bring back to the large group so they could see how people focus. So as an example, using our 4 areas, which have gotten tweaked in regard to naming, the number of items across all documents was 752. And as you can see, the majority of those items were under instruction or intervention. We gave up the word therapy. I shouldn't say we did, because I'm not a therapist, I'm a special educator. The therapists gave up the word therapy, though sometimes it comes back. There's nothing wrong with it. It was just we were trying to clean up language to make it not so cumbersome. So this is for therapy, instruction, and intervention, that 54%. But as you can see across the left, there's different organizations. And here's one example of what it would look like. So under family-centered practice, family involvement and assessment, which is an indicator of a competency, each one of these organizations wrote it a little differently because their organization did. But if you look through it, we're all saying the same thing in different words. But we're saying the same things, which it reinforced to all of us that, and not just, I mean, ECPC, I mean, all of the organizations, that we really are doing things more similarly than different. There are very specific practices that only a PT or a speech and language pathologist or an OT could do, but it's really more common. And I apologize to AOTA, because we did have an AOTA and it dropped off the slide, and I didn't pick it up until right beforehand. So OTs also had it. But the methodology continued because then we wanted to see what was common across at least 2 discipline documents. And this is a whole list of different competency areas, if you will. And as you can see, the top names are getting changed. Every time we met, we did wordsmithing, so everybody could live with it. We did modified consensus. Can we live with it? And there was a lot of opportunity for change, and people went back to their organizations and wanted to see how it lined up. But our final revision was done almost 2 years ago. And the revision was primarily to the words up front and the sub areas. And we also had cross-category themes that we knew that ran in each one of them. So starting in the winter of 2016, all of the professional organizations brought these to their board. And the boards all endorsed, gave an endorsement that these would be cutting across disciplines, competency areas for those serving infants, toddlers, and young children with disabilities, no matter where they were. So it's not just kids under IDEA, it could be kids who are receiving just one discipline in a clinic because they don't qualify for IDEA. But these are the ones, areas, and these are the final area. Though I will tell you, we had one more change this past year, which everybody thought that the intervention and instruction as informed by evidence was too cumbersome, so it's just evidence-based practice, which makes easy, but it took us the 4 years to get there, I think. So here's the definition. So going back to here, definitions that were agreed upon that went to the boards. Family-centered practice is the delivery of culturally competent, family responsive, early childhood intervention, respects and facilitates a family's active participation and partnership in the assessment, planning, implementation, and monitoring of the interventions delivered to their child and themselves. So this is one of the things that we all hang our hat on, but now it is right there, every organization endorsed that all of those who will provide services to young children under IDEA and other places need to have this competency. Coordination and collaboration is the alignment of early childhood intervention services, interventions, and community resources to support a collaborative cross-disciplinary and cross-agency service delivery process for infants and young children. Again, acknowledging that we have to cross services, interventions, and resources. Evidence-based, use of scientifically based evidence to inform all screening, assessment, intervention, and evaluation practices implemented with child and family, and then the collection of reliable data to document, monitor, and make decisions about the effectiveness. And I think when you look at this, you're like, well, yeah, we should be doing this, but now that it's there in a document that every organization endorsed, it has a little bit more weight. Professionalism is, by the way, ECI, early childhood intervention, was adopted instead of going back and saying early intervention and early childhood special education, because the disciplines, not special ed, are more than just related services to many families. So it's just ECI is early childhood intervention, birth to 5 for children with disabilities and their families. Anyway, and discipline-specific laws, policies, ethical standards, and practice guidelines by all service providers who take responsibility for continued learning through self-reflection, professional development, which they share with others through teaching, mentoring, and coaching, and demonstration of advocacy and leadership skills, local, state, and national. This was a biggie, and I was quite pleased that ethics really kind of was something everybody felt very strongly about, as was advocacy, and wanted to formalize it. Now, these next slides are very small, so I'm not going to go through them all, but these are the examples, and I'll give you the reference to this, and we can make this available. What the examples are not endorsed by the disciplines and the organizations, because the examples can be done in a variety of ways. These are the indicators and competencies that a professional development provider could adopt and use, that Part C or 619 could use as competencies they want everybody to have, and higher ed could be using across disciplines. This goes on, and I actually have these broken down so it looks a little better to read them this way. But they range from coordination and collaboration, which basically has the linchpin there, collaborates with the family service providers and agencies to develop, implement, monitor an individual family service plan, or IEP, all the way down to facilitates transitions. Family-centered practice is being able to effectively communicate with all families across culturally, linguistic, and social economic backgrounds, to refers families to resources and services. Evidence-based intervention is using valid, reliable, non-discriminatory child-focused assessment, a little spacing problem there, for eligibility, child family strengths and needs, and child and family progress. And then professionalism is picking one, learns from, with, and about all team members within an interprofessional collaborative practice framework. So this is what we did. Took a long time, and my big question that I always ask for everything I do, usually in life, but definitely when we're putting our resources, what's the so what question? Why are we doing this? Why is it important? So we go back to the fact that early childhood intervention is really based on a team model. We recognize that not one individual or one discipline has all the answers for a family and child. So if we use the fact that service delivery teams are what we've been built on, we know that in order to be a good team, you need to be able to share expertise across your members and to be able to develop a framework for intervention for a family and their child. The DEC recommended practices and interdisciplinary models, which is teaming. Teams include family members making decisions, professionals cross discipline boundaries. Intervention is focused on function, not services. And caregivers and regular routines provide the most appropriate opportunities. So these competency areas support the DEC recommended practices, because as you want to go back, if you want to go back, all of these are represented in multiple indicators. The general role of service providers, which again, long time ago, but when we first had infant toddler programs, we had a caveat that basically talked about the workforce for infants and toddlers not always being direct service. In fact, the service providers in this area, no matter what their discipline, are responsible for consulting with parents and other service providers and representatives of appropriate community agencies. So there's your cross-disciplinary, cross-agency. And then training parents and others, which includes your other service providers, no matter what their discipline, regarding the provision of those services. And then doing a team's assessment and developing integrated goals and outcomes. So I think right there we have a so what. We have a so what that the law stated what the workforce does. We have recommended practices that talks very specifically about team models. And when we talk about a team, we need to have that common philosophy. This is a definition of what's an effective team. Working together and sharing the philosophy and common goal. You need a unifier if you're going to have a team. And one of the things that we have seen, the elephant is always the financing of some of our models, is the fact that financing has resulted in a decrease in team time, where teams are getting to work together and know each other. But if they had a unifier, they could develop their work scope and their work style a little bit better. Because one of the things we don't want, and I give credit to Michael Giangreco, who writes the best cartoons, who gave me this, is the fact that we don't want to see an IEP or an IFSP that have separate pages by different disciplines, which most of us have seen more than we'd like to say. And we really want to give our team members a focus of how we pull together across disciplines, each background, but more importantly, what's the outcome we want. And if we really go focus, sorry, I think I'm a little out of, I'm going the wrong way. I'm sorry, I'm sitting here. Let's go back here. We really want to focus on the team, which basically says the greater the challenges, the more the skill the team, not individuals, but the team needs to have working with the child. This is a picture that just talks about something. This picture, I don't even want to tell you how old it is, but it came out of the 70s when early intervention was really becoming formalized, and people were moving into the transdisciplinary team model because families were being very appropriately vocal, saying it was very confusing to have multiple people saying different things that their child needed or they needed. Even when that team might have come together, they still saw the child very differently. So the transdisciplinary team was adopted in the late 70s, but what it really did for us is unify the fact that these young children really don't develop separate domains, that's developmental domains, only when a certain discipline is working with them. That in fact, it is in all fairness to the child and the family that we're looking at them as an integrated child who is learning, and that we build our expertise around that, as opposed to having the child and the family try to figure out which discipline and domain we're working with. So when we look at these four, the so what component is really how do we build a workforce that is competent and confident across these areas and feels comfortable sharing skills across domains. We are never going to take away a PT's expertise by doing cross-disciplinary or a speech and language or a special educator. In fact, building it together in these four areas really allows people to complement each other. Because as I started out, we really are looking for impact of child and families. And if we want the impact, this is one unifier that allows us to move forward and look across these four areas. How are we going to measure that outcome? Now, as we see in many of our practices, the implementation is really the key. We don't usually have the opportunity to have a miracle occur. And what does it take? It takes a lot of work and a lot of reframing. A different paradigm has to be adopted by our interventionists. And our paradigm to change is that the discipline does not equal the role within the family and child's life, nor does a role equal a discipline. Neither the discipline nor the role equal competence. Competence comes from people being able to have the knowledge and skills to be able to provide intervention based on the evidence base we have across those four areas that we adopted. These are a lot of different people who are in a family's life, and they all have different backgrounds and expertise, and sometimes they have very different philosophies. And our job is to really, in order to impact that child and family, pull it together and pull it together with the common language and the common view using these four unifiers. Because when we look at how kids learn, they don't necessarily have to have a specialist by their side. And they don't necessarily have to only do one discipline and domain at a time. Kids are the ones who are really sharing and showing us. And what we need to do is to be able to figure out individually, where are we now, both as a service provider and then as a state C or 619 person who's responsible for their state workforce or a higher education faculty. Where do you want to be? I hope we want to be in a place where we have providers who see the world the same way around a child and a family. And what do we need to do? And that's where our pre-service and in-service need to come together so that we have a continuum. And that continuum really allows a practitioner to start off in a higher ed program and be able to continue in a personalized learning plan to be able to get to the place they want to be to demonstrate. So as we close, I always close with reminding us why are we here. And I will just let people know as a hint, this is when my girls were the most fun. Now they're teenagers and I don't need to say anything more. But they're still very good friends with Aiden. And in fact, the one with the crown, Mary Grace and Aiden, work together in an inclusive cafe now. The reference I told you all about, the competency, this long article that really draws out this systems change we did in trying to get the unifiers across these specific discipline organizations is here. And if anybody wants to email me, I can send you a reprint or it's up on our website too, ECPCTA. And that's all I have to share. I know I gave you a lot of information, but please know our website will have all of this information. And I thank you for your time and really thank you for your commitment to young kids and families. We want to make them the best they can be, and the workforce is how we're going to do it. So thank you.
Thank you very much, Mary Beth. We had a couple questions came in, actually all centered around wondering if they would be able to get a copy of your PowerPoint.
Yes, absolutely. I have to take the pictures off, but yes. Jen, I can send you another one. Do you want to send them out or do you want me to send it? Just tell me how. I can do
Perfect.
that.
Yes, I will have Mary Beth finalize her PowerPoint and send it to me. The recording is always posted on the Grads 360 site where we house all of the OSEP monthly TA calls, and usually additional handouts can go there. So once I receive the final PowerPoint from Mary Beth, we can put it up there as well. If you have any other questions for Mary Beth at this time, feel free to enter them in the questions comments pod and I can pass those along. But I do know, I believe, Greg, you had some other comments in the end if you wanted to do those now.
Jennifer, can I just say one thing?
Of course.
At one of our last meetings, people had asked us, how do we get this information down to the state level? So our professional organizations are working with us to get some one-pagers that will go out to the state affiliations of these professional organizations, and we'll make available to the C and 619 offices, as well as any other way that people want us to wrap this up from like we have a checklist that people can use.
Perfect. At this time, we haven't had any additional questions or comments come in. Greg,
well, I'll go ahead and Jennifer, this is Greg. I'll go ahead and kind of start closing, and I'm watching the chat box just in case anything does come up. But in the meantime, I want to thank Mary Beth so much for sharing this information with us today and letting us know about some of the very important work that ECPC is doing. I want to thank my colleague, Christy Cavalick, for being here with me today and helping make arrangements for the TA call. Of course, thanking Jennifer Reed for her excellent assistance that she brings us and making sure the technology for all these calls works so well. As I said at the opening of the call, for Part B folks, for anybody, but particularly for Part B folks that are on the call, you may be interested in joining us next Thursday, the 20th at 4 o'clock for a walkthrough of our expectations for how states complete Section 5B of the Part B IDEA grant application. That's the data submission for significant disproportionality. And we will be sending out the details for that call tomorrow. I am not seeing anything else in the chat. Are you, Jennifer?
Nope, I am not seeing anything at this time.
Okay, so then thank you all once again, and we will close out this call. Everybody have a good day.
Thank you, everyone, for participating in the call today.